Hi there. This is the Aligned Birth Podcast. You have two hosts of the show. So you got Doula Rachael here, you've got Dr. Shannon here, and we talk about all things motherhood. We talk about all things pregnancy, birth, labor, postpartum, prenatal. Lump that up into perinatal, and that's what we talk about on the show. Today's topic is, if you're a jaw clencher, there's a good chance that your pelvic floor is tight. That's like a fun little statement. So we're going to talk about how the jaw is connected to your pelvic floor. So we're going to do an anatomy lesson. Hang with me. Don't freak out. It's anatomy lesson, but we're going to go back to embryological connection. We've got anatomical connections. We're going to talk about the nerve connections, because you got to understand that to really, when you get that and you see the connections, you'll be like, holy moly, I have so much that I can do by just relaxing my jaw that can relax your pelvis, that can impact pregnancy, labor, birth. Like, that's what I want to have that connection here, so that you know, like, hey, I can do this, and it's really simple and it can be really, really impactful. So again, we're nerve connections, how everything is connected in the body, and then we're going to go into ways to tell, are you clenching your jaw? Is your pelvic floor tight? And what are things that you can do about it? So I'm really excited to geek out on this show today. I hope you are as well. And I know Rachel's ready to geek out on it. So welcome to the Aligned Birth Podcast. I'm Dr. Shannon, a prenatal chiropractor.
And I'm Rachael, a birth doula and childbirth educator. Together, we're here to bring you conversations about pregnancy, birth, and motherhood. From cesarean to VBAC, hospital to home births, we've experienced it all. We are high school friends who reconnected through our shared passion for health and birth. As moms to two young boys, we've both changed careers after our own transformative childbirth experiences.
Join us as we discuss the importance of a healthy body and mind throughout pregnancy, birth, and into motherhood. Our goal is to provide fun, interesting, and helpful conversations and interviews that inspire learning. When your body, mind, and intuition are aligned, you can conquer anything.
Sit back and relax, or grab a notebook and take some notes, or maybe listen as you enjoy a walk. However you choose to listen, we hope you enjoy this episode of the Aligned Birth Podcast. Before we get into the episode today, if you enjoy the content of this podcast, we would greatly appreciate your support in one of three ways. First, leave us a review or give us a 5-star rating. Your feedback helps us reach more listeners and make a bigger impact. Second, you can sign up for our newsletter. By doing so, you'll be the first to receive new episodes and exclusive bonus resources straight to your inbox each week. Lastly, you can become a direct listener supporter. Running this podcast requires significant time, effort, and resources. Your contribution, no matter the amount, helps us continue providing valuable content to a wider audience. Simply use the links in the show notes to make your donation, sign up for our newsletter, or leave us a review. Every contribution matters and is sincerely appreciated. If the Aligned Birth Podcast is a part of your weekly routine and you love what we are doing, please consider supporting us through one of these three options. Your support will create a ripple effect, allowing us to reach more listeners and make a lasting difference.
Hello, friend.
Hi, Dr. Shannon. Yes, I am ready to learn. Take me to school. I was looking over this outline and was blown away by all the information you're going to be sharing today. I am a jaw clencher. I have learned a lot about how to release the tension in my jaw to promote overall health and well-being. I thought it would be a simple fix. It's kind of multi-layered, and as I'm just looking over the information you're going to be talking about today, I'm like, oh, okay. I get it.
I get it now. I get it now.
And then I talk a lot about it with our clients who are preparing for birth, but I've also kind of lived my own personal experience with the tight jaw and pelvic floor issues. So, and how it all weaves into birth. So I'm here for this conversation today.
Something just came to me. So I have a 14-year-old. So he's in 8th grade, and If you're watching this on YouTube, you'll be able to see what I'm doing. But there's this whole thing going around about mewing, which is like strengthening your jawline, which is like really forcing your tongue to the top. Have you heard of this or seen these stupid
I've heard of
videos? And it's
this.
all over the place.
Yeah.
And so now he goes around and you do like the shush sign. Like you can't answer. I can't talk to you right now because I'm mewing. He'll do this to me all the time. And he'll like, you do the shush sign and then you put your hand along your jaw to be like, can't talk. I'm mewing. And that just reminded me of that. Because like, we're talking about the jawline today. I'm not going to tell you how to mew. That's what we're talking about. But I'm hip with it, y'all. I'm hip with the times.
You are.
And
yeah.
8th grade lingo. Anyways, okay, sidebar. We are going to do an anatomy lesson today. It's very, very basic. Because every time I tried to get really, really complicated, I took it back down. Because I just loved learning about this in school. It's like when I learned the spinal nerve chart and saw like, oh, this nerve goes here and controls this function of the body. So when I adjust the body, this can impact this part. Like it makes sense. Like it's kind of that aspect of things. So we're going to start all the way back at the beginning. We're going to go back to embryological development. I think this is the biggest like mind-blowing part of it that you may not realize. So if this is day 15, so right, egg and sperm have come together, they did their little dance, and now you have all these little cells forming. You got like 2 cells, 4 cells, 8 cells, 16, 13, it goes. You go through blastulation, then you get to gastrulation, and that's where it forms, like the ball of cells start to kind of like form into a tube, and then the tube has 2 openings on it. And so you've got one end is the oropharyngeal membrane. That's going to form the mouth. And these are connected, right? This tube is connected. And then the other side is the cloacal membrane. That's going to do the urinary tract, the end of the digestive tract, reproductive tract. So whichever sex it's going to be, but you've got to think, vagina or penis, you've got anus, like all of that is formed at the beginning. Then they start to separate, and then the spinal cord is what forms in the middle. So it is embryologically connected, the jaw and the pelvis, and then they stay connected as the spinal cord forms. So I think that's really, really cool.
Cool is not,
I know, right?
It doesn't even like, so this, we're talking about like our own, our own creation from, and then, think about it as you're preparing to give birth, like what's happening with your baby on the inside. Yeah. That's super cool.
And side note, this is why, and we've talked about this in so many pediatric chiropractic episodes, but this is why if I've got babies with tongue-tie issues or nursing issues or anything like that, this is why I'm doing sacral work, because the jaw and the tongue and all of that is connected to the sacrum. So like that's the beginning stages of it as well. So sidebar note on that. Now I want to go into, I kind of put it into 2 different sections. So we've got like internal anatomical connection. So this is more like brain and spinal cord. Then we're going to do an external one, which is more of like the bones and the muscles. So like outside of the brain and the spinal cord. So internally, you've got this thick connective tissue that covers the brain and the spinal cord. It's the same tissue. And it's got 3 layers. So we'll work from like outside in, but you have like dura, arachnoid, and pia mater. And the dura mater, this is like, I love this, is Latin, mater is mother, and dura means tough or durable. So you literally have a tough mother surrounding your brain and your spinal cord. I just love that so much.
That's
cool.
You
got a tough mother. You got a tough mother, and
sure
you're surrounding some very, very valuable parts of your body. So you've got this dura mater, and it comes up into the skull and into the brain, and it forms around it. It's connected to the skull, but it forms these caverns. It's got a couple different layers in the skull. So there's a lot more to it as well. But that's where you've got these caverns in there. That's where the cerebral spinal fluid is able to flow around. And then that bathes the spinal cord as well. Then the dura mater comes and it connects and it surrounds the spinal cord as well. Now, remember the word, and remember we've talked about epidural, like you get an epidural. This is where that word comes from. It's literally just a Latin word. Epi means above, and dura is the mother that's surrounding the spinal cord. So it's between the dura and the vertebral wall. So there you guys, a fun little, so now you know what it means. Now, the dura mater is also anchored at the foramen magnum. So that's where the spinal cord like comes down and from the brain, and it goes all the way down to the coccyx. And so it's connected there and called the filum terminale. So now you know Okay, embryologically it's connected. Now anatomically, we've got this surrounding connective tissue that's connected to the bones, but also surrounds the brain and the spinal cord. Now we've got some external, I call them anatomical connections. This is more of like the bones and the muscles. There's this book called Anatomy Trains, and we talked about it in school, and it's so fascinating. I love this book, but you've got this fascial system that covers all the muscles of the body. So when you're doing foam rolling, that's myofascial work. That is what you're working on, is that fascial system, that because that can hold a lot of tension as well, not just the muscles, like the fascial system outside can hold a ton of tension. Then you've got, and this again too, this is not just the only fascial systems in the body, you have a lot more, but this is what I wanted to focus on today. You've got the posterior and the anterior. So when you think of your jaw and that TMJ joint, that has muscle and motor supply to it. Like that has muscles that cause it to move, that cause you to chop, that cause you to be able to chew. Those muscles are connected to the neck muscles, which are connected to the back muscles, which are connected to the muscles of the pelvis, which are connected to the muscles of the pelvic floor, right? So it literally is that, silly little song, the neck bone's connected to the neck, that whole, like it's literally, this is part of that, as how it's all connected. And then this is related to posture and stability in the body. So when I'm working with patients and I see that we have the ear in front of the shoulder, that's that anterior head translation, that's that text deck. And then I try to tell people it doesn't only cause neck pain, it can also cause low back pain. It can also cause low back tension. It can cause pelvic pain. It's because it's all connected. So again, there's that aspect. That's the posterior. And then anterior, you have the anterior cervical muscles, and that's going to connect to the chest. And it's also going to connect to like anterior aspects of the pelvis as well. So that's kind of our internal, external, anatomical connections. There is some nerve supply. I only want to go over a couple of the nerves. And so trigeminal nerve, this is the fifth cranial nerve. We talked about this a little bit. This is what gives motor sensation. It's sensory and motor to the face and the jaw. So again, remember, if you've got, there's a lot of people that have TMJ issues. There's a lot of people, and it's not even just clenching your jaw. Like you can just have issues with the joint itself. But that, if you've got tension, something is off with the jaw and the alignment, then that's connected to the neck muscles, connected to the back muscles, connected to pelvis. Okay. So remember that aspect of it. And then of course the vagus nerve. We talked about the vagus nerve before. I won't go into in depth. It's another cranial nerve. So it's the 10th cranial nerve. This is the one that comes out, it's not from the spinal cord. This is from the skull, comes out and really is very, very close to that top bone in the neck. So C1 atlas, and it comes out kind of laterally beside that. And then this is that parasympathetic control of the heart and the lungs and the digestive tract. This is sensory and motor. So this is how the gut communicates to the brain and the brain communicates to the gut. And there's also branches of it that lead off into the pelvic floor as well. So now we have that connection, the nerve connection from the skull into the pelvis. Okay. Hopefully you're still with me on the anatomy lesson. Now, you can't really talk about this without talking about cerebral spinal fluid. And I can't really talk about cerebral spinal fluid without talking a little bit about a craniosacral pump, which is another way everything is connected here too. So that cerebral spinal fluid, that bathes the brain and the spinal cord. And it's this wonderful liquid that provides protection. It provides nutrients and then takes away waste as well too, just in a nutshell. It is, I like to think of the motion of it is a little bit like, how the muscles of the body, so the heart pumps and uses the arteries to pump blood away. Well, you've got this venous supply that doesn't have that same pump. So as you move your body, that's how the blood supply gets back up to the heart. Okay. And then the lymph supply too. That's the motion and the movement that you have. It's kind of the same thing. There's a little bit of motion and movement that allows the cerebral spinal fluid to bathe the brain and the spinal cord. So it's formed in the brain, covers the brain, and it's this like pulsatile motion. So you've got the heartbeat in the brain, you've got a blood supply to the brain, obviously. And it's as the beat in those arteries, it kind of pushes on the ventricles where that cerebral spinal fluid is and moves around. And then you have these little cells that have these like little hairs on them, little cilia, and they just go wee and like push all the fluid around too. And so you've got those parts that are pushing it around in the brain, but then you have to think you have that motion and movement of the spine. That's going to move that fluid around. Now, you have this craniosacral pump. So you have the cranium and the sacrum. We've talked about the ways that it's connected, nerve related, the connective tissue, the muscle connection as well, and then that bony connection with the skull and the spine. But now it's also connected in this motion. And I'm not talking big motion here, not big movement, but there's a craniosacral pump, and it's this motion of, you've got this free floating bone in the skull called the sphenoid, and it's this beautiful like butterfly shaped bone. And where it joins kind of with the occiput, it does a little bit of rotation as the sacrum moves, and the sacrum moves in a certain way as well. And as you walk, your body is able to use like that cerebral spinal fluid, kind of like the oil for that system, and it uses that, and that pumps the cerebral spinal fluid around as well. And it's kind of like this primary respiratory mechanism, and not to go into depth with it, but there's that inherent rhythm of the brain and the spinal cord. There's tension in the dura mater, and then there's the motion of the cranial bones and the sacrum. So kind of think of how that rib cage expands as you breathe. It's a little bit like that as well too. So this is a little bit of the anatomy lesson, really, really quickly, not to overwhelm, but I just hope you understand like all of those little connection points, and how when I say everything in the body is connected, it really is. And it actually goes all the way down to your toe, but we're not even going to go that far. It's connected to the toe.
Girl, your wealth of knowledge is like incredible.
No.
And I love it. And the way you just like went through, there's a lot there, right? And I'm sure each of those you could continue down.
There's
talking,
a lot
but
more
you made
to
it very understandable and simple. I do have to, I was thinking in my head, I was like, I think I'm going to give a little bit of a podcaster tip. And a lot of people who listen to podcasts all the time will listen to like on 1 1/4 or 1.5 speed. I don't know if you do. I'll listen to podcasts on a higher speed so I can kind of get through more, because I loved listening to podcasts. But here's my tip. People need to go back and start that over and listen on like half speed.
I know. I am from the South, but sometimes I don't talk like I'm from the South.
No. Well, and just so people can take it all in.
Yes.
And
like take some notes.
And like take some notes, because that's super, super cool. So
we'll go back and touch on it when we go into okay, what are the implications for pregnancy and birth now? And what does it look like if you have cranial work done? What does it look like if you have chiropractic work done? So I'll go back and touch on those things too. I know. I hope I didn't go too quickly with it. But
and I thought you so kept much more as simple as you could.
Yeah. There's so much more to it.
Because like you said, like, and I get in these like conversations when I'm talking about birth of like, I can't usually just talk about one element of either pregnancy or birth without elaborating on something else, so that people can get the whole picture.
You
gotta like, I can't talk about this without talking about this, because it's all connected.
It's all connected. And isn't it just, when you look at this and you think of this, I can't help but be in awe and wonder of like how we are made, and just this like beautiful, amazing design. So I hope it gives you a little bit of honor for your body, and like, holy crap, this is really, really cool. I am so beautifully and wonderfully made. And now we can get into, okay, what can I do to help all of this function better in the body? Because again, that's what I have people in the office, and I'm like, yeah, I want you to feel better, but I want you to function better. Because when you're functioning better, ultimately you're going to feel better. Things are moving better. Everything is connected in the body. There's this also thing of like tensegrity. I remember learning this in school, and they had these like little, I don't know how to describe it. It had like little wooden balls and wooden sticks, and they were all connected, and you move it and it all moves, like every piece and part moves, but yet there's tension. It can also stand. It has structure and it has stability. So there's that too. But again, when you move and you've got, an irregular bite and the right side of the jaw doesn't open all the way, well, then that's again connected to the nerve supply there, to the muscles in the neck, to the muscles in the back and on the front as well too, and everything down into that pelvis and sacrum. And now we have right hip pain maybe, or something along those lines.
Right. But
chicken
everyone
or the
wants
egg.
to go directly to the source of the pain.
Source
Like
of the
wherever
pain.
it's signaling is like, well, let's fix that.
Mm-hmm.
And if we're not getting results quickly, typically we might go to like medication or pharmacology to help us because it's not feeling better. But when it's like, well, looking at that whole system, and that's why working with practitioners like yourself can be so beneficial. And
Mm-hmm.
I don't ever want to discourage not going to the doctor.
Oh,
It's just our
definitely.
current like model doesn't support that holistic functional approach of like the hip bone's
Everything's
connected to
connected.
the
Mm-hmm.
like leg bone and all of that, like that it's all connected. And because I don't really know why it is the way it is. That's maybe a conversation for another day, but it's
Yeah.
like there
Yeah.
are roles for them. But I have found even through my own personal experience and through coaching so many people through pregnancy and birth of like when you could work with practitioners who look at the whole, like for me, it was
Mm-hmm.
like pelvic floor therapist and chiropractor put
Mm-hmm. They both
together
tend to
was
look at the
like
whole. Mm-hmm.
my I've had the greatest success with recovery and like really because I
Mm-hmm.
struggle with chronic tension and chronic pain. And I've been able to resolve a lot of that, but it manifested in the jaw and then in my back and my sacrum, my
Mm-hmm.
pelvic floor. And so working in with certain modalities and certain treatments that we'll talk about, but it was like, it wasn't a fit. It wasn't a quick fix.
No, yeah, you've
And
got some unwinding. I use that a lot in office. We've got to unwind some things because it's been
unwind.
wound up for a minute. And
Yeah.
like a swing, right? And you spin in the swing and you're all like kind of twisted and wound up. Well, it's not just one little twist and you're completely done.
No.
So there's a process to it. But I'm glad you
Yeah.
mentioned that because the next thing I wanted to say was there's this guy. Oh, I should know this. I feel like his name is either Perry or Terry. He's called Stop Chasing Pain on Instagram. I'm pretty sure he's a chiropractor, or he's like, that's where his original training is. But he
Mm-hmm.
has all of this information. He is so in tune with the lymphatic system and how
Mm.
important it is. And he has all these little educational classes that he offers. It's called Lymph Mojo, and it'll be all different parts of the body. But he always says that no system works alone, no part of the body works alone. And
Mm-hmm.
I think it's important to know that. So yes, we do need specialist doctors in certain areas, but again, too, that's why side effects on medication is going to say, well, it can cause this whole range of things, ranging
Mm-hmm.
from issues with your heart to issues with your muscles to issues with your kidney. Like it's all connected,
Mm-hmm.
right? So that's
Mm-hmm.
one way to look at it as well, too.
Mm-hmm.
So there's a couple like what to look for. I mean, this does make sense. Like how to tell if you're clench your jaw. Well, do you have jaw pain? Okay, that's a little bit of it, but looking at there can be jaw tension. You can clench your teeth. Sometimes dentists will tell you, when you go and be
Mm-hmm.
like, do you grind your teeth? Do you clench your teeth? And you may not have any jaw pain, right? But you may be clenching, your dentist may notice, and you may actually already have low back or pelvic pain. And it's
Mm-hmm.
just you're just relating it to the pelvic and low back pain. Maybe there's a little bit of that jaw connection there as well, too. So again, you don't necessarily have to have jaw pain for there to be an issue, but grinding your teeth is one aspect of knowing. My last one was stress on this list. Tension headaches. So when you do clench your jaw, you are engaging, and sometimes you can even feel that headache up along like the temples where those masseter muscles like come down. That can also indicate like we've got some jaw tension there.
Mm-hmm.
Pelvic floor tension. We've had several. Have we had several pelvic floor PTs? I feel like we've had at least two because we had
Mm-hmm.
Brandy and we had Tina.
Mm-hmm.
Um, and I know they talked a lot about pelvic floor
Mm-hmm.
and what is the pelvic floor and what happens if there's tension. You can have hypertonic muscles, hypotonic muscles. So you can have too tight or too weak of pelvic floor as well. So typically if you've got the jaw
Mm-hmm.
tension, I think you're going to have more of a tightness in the pelvic floor, but
Mm-hmm.
that's something to look at. And so you can have a whole myriad of things as far as pelvic floor pain. You can have pain with sex. You can have incontinence. This could be before pregnancy. This could be your second pregnancy, like postpartum aspects of things like not to go into the whole gamut of all the pelvic issues that you can have, but it can also be low back, because remember, that's also pelvis area as well too. Like that's all connected.
Mm-hmm.
And then
Mm-hmm.
stress. I mean, a lot of times you clench the jaw with stress.
Mm-hmm.
So
Stress.
that's why
Are
I
you
put that
feeling
like at the
stressed?
end.
That question is always like, well,
any
yeah.
stress? I know. I
But
always
it's how
ask, like,
what are we doing to cope with that
how do
stress?
we
And that's
adapt
that.
to it?
Yeah. And everyone has their ways. And that's why just being aware of how you're handling stress and then figuring out the ways of how to like minimize, reduce, because we're all going to have stress.
You're
So
not going to get rid of it.
no,
Mm-mm.
like it's how are we setting ourselves up
Mm-hmm.
for, getting through our days and our lives, acknowledging and honoring what our body needs.
Mm-hmm.
And a lot of those healthy habits that you hear people talk about, but they are tried and true, is like sleep, good quality sleep, surrounded by good sleep routines on both sides, and good hydration and physical activity, and, just eating well as you can, and just like trying to listen to your body and your responses to certain situations, and giving yourself ways to cope in a healthy way so that things don't build up over time. I just think stress is one of those things. It's important to acknowledge, but not like say that don't be stressed.
Yeah, no, I want you to adapt to the stressors. I say that a lot in the office too, because you're going to have stress, and stress can be good. I mean, that's how we build muscle, that's you stress.
Mm-hmm.
There's stress,
Mm-hmm.
but there's that chronic level of fatigue when we are at a heightened state of adrenaline and cortisol that we don't necessarily need to stay there. And that's when we're in that sympathetic mode. There's that disconnect in the nervous system, and we get stuck there and we think we're in fight or flight all the time. We're not allowing ourselves to rest as well. So I just kind of threw stress in there. I was like,
it's important.
If you got stress, you probably have some tension,
But it's all about acknowledging and honoring and setting up some systems in your life that help to mitigate that. And I just gave a few examples, but I think it's worth spending time on so that we talk about this a lot with our moms who are expecting and their families, as far as like stress is inevitable, but like, how are you handling it? How's it making you feel? How are you sleeping? How are you eating? What's your hydration levels like? Because we know that if we, especially with the pregnant body, getting into a heightened state of stress has lots of downsides and potential negative consequences. So we really want to make sure during pregnancy. So we're talking about this early and often with our clients, like everything I just said, so that when it comes time for labor to start, like all of the pathways are open, because cortisol can actually do two things, which is our stress hormone, right? It can actually trigger preterm labor, or it can prevent labor from like progressing. And we use cortisol is actually important in labor, keeps our senses heightened, helps us,
it's important.
It's important. And then when it comes to get baby out, it's time to like deliver. We need that adrenaline up. So it serves roles, but
it needs to be like turned on and off at the right, like the little light switch. It needs to be on when it needs to be on, and off when it needs to be off, not just like kind of
right
steady state. So that's a segue into a little bit of like implications if we have this pelvic tension during birth. But I'm also going to say, if we have this pelvic / jaw tension during birth, sometimes that stress, what we just talked about, it can lead to, I know for me with my first birth, there was stress and there was fear, and that led to my inability to really surrender to the birth process. And I think that's big for a lot of first-time moms. I think that's big for maybe second-time moms if you are hoping for a different birth experience, than first time around. And if it wasn't ideal, then it's like there's a lot of pressure on, there's a lot of stress around that. So, but then it doesn't even matter because birth is unpredictable anyway. So it's, each birth is so different. So it makes sense that there is the stress and the fear, and how that can lead you to not being able to surrender as much. But that's that cortisol aspect of things. That's that tension in the jaw, tension in the pelvis. And if we have so much tension in the pelvis, we can't really like let it go, you can't
Well,
really
and I
relax it.
think a lot of people have like in their mind a mindset of surrender or like an intentionality around
Mm-hmm.
approaching the birth with surrender and less tension, but then their body is holding some tension.
Yes.
Like we have
Mm-hmm.
that subconscious
Mm-hmm.
situation where, you know, underlying fears and underlying stress and doubt and unknown are there. And so that's why, even if the mind is like, if you're outwardly like, yeah, I'm good, I'm feeling good, I'm excited, I'm surrendering, all the things, we still encourage like checking in with your body. And
Mm-hmm.
obviously we encourage like things like chiropractic care, pelvic floor therapy, massage therapy, because that's also releasing tension in all the right ways, but also tuning in with yourself and doing like breath work and movement to pay attention to where you're holding stress. Like we'll give examples of like in your day-to-day life when you are exposed or feeling stress by work, by traffic, by if you have other children or a fight with your spouse, like wherever you have tension in your life or stress, like if you can try to be aware enough to take a minute and be like, where am I holding my tension when I'm actually experiencing this external tension? And is it
Mm-hmm.
in my shoulders? Is it in my jaw? Is it in my pelvic floor? And even though they're all connected, if we can kind of just see like, oh, I'm holding it there, or do that active like tension and release of those
Mm-hmm.
areas, like
Mm-hmm.
actively clench and then release, and actively like shrug your shoulders and then let them go, actively clench your pelvic floor and then let it go. Like that's this like reset, because in labor, like you have this like wash and repeat thing that has to happen, this wave like pattern of where tension will come, and we have to be able to acknowledge it and then release it over and over again. And it's not just like, okay, I've
Yes.
learned about birth, I have a doula, I've got this plan, go. You have to be like practicing
Mm-hmm.
that release of the tension and where you're holding stress, starting like as soon as you can in life. I mean, preconception, pregnancy, labor, and then that practice serves you in postpartum too, because we all know that comes with stress too.
Exactly. Everything you just said. I love it. Because we're going to go into that in a minute too, like the ways and what to do. Okay, if we've got that tension here, and you touched so beautifully on like so much of that and why, and then the practice aspect of things. Because this is why childbirth education is so important as well too. This is why labor support and having a doula is so important as well too. To be like, hey, remember, you've learned this. We've
Mm-hmm.
talked about this. Go back to your birth affirmations, listen to the music that you've practiced during your
Mm-hmm.
pregnancy, so that you now have ingrained that response in your
Yep.
body of peace and calm. So you've got to
Mm-hmm.
train yourself, just like you're doing
Mm-hmm.
a race or something. You got to train yourself to have that response. It's really difficult. I mean,
Yeah.
but it's worth it, because if we do have that stress and we do have that fear, and then the birth pains come in and we're losing our coping mechanisms, and we're having a hard time surrendering, that's what can lead to that prolonged labor. And so, not all the time, but in one instance of it, if we're looking
Mm-hmm.
at jaw and pelvis connection, where we're holding the tension in the body, then, and also, I mean, you got to implicate vagus nerve here, because that's, I feel like that's like your safe nerve. Like that's when you can get into that parasympathetic state and you can stay calm, then it allows those hormones to flow freely. It allows you to receive a situation and plan that response in a better way. It allows you to surrender a little bit more when you feel safe. And I sometimes feel like if that vagus nerve is activated, we'll go into those ways in a minute again on how to do that. But I do want to mention Ina May, because I feel like in a lot of um, childbirth education, or just childbirth in general, she comes up.
Mm-hmm.
And I don't know that I'm not going to say she was the first one to mention like, oh, relaxing the jaw, but I know a lot gets traced back to her as far as like saying, I'm sure it's like a midwifery aspect of, that's when I first heard about it. Well, obviously in school, but like when setting up my prenatal practice and working with midwives, and then hearing midwives say that when they're working with moms and they're in labor, that they would have them, if they're wanting to squat, well, let's work on relaxing the jaw, because sometimes it's also hard to us, like, if you focus so much on that area, like, okay, the pelvic floor is tight, baby's not coming down, there's a lot of tension there. It's hard to be like, okay, and release the tension, like you got contractions going on, you got hormones, you got everything. But if you can say, okay, I want you to clench the jaw and I want you to relax it. And I want you to clench and I want you to relax. Because now I want you to know what the tension feels like. And now I want you to know what the relaxation feels like. Then I want you to stay with that relaxation state and focus on that. And so when you bring that focus elsewhere, that's like childbirth education with the pain coping mechanisms, squeezing of combs, ice cubes, those type of things. It diverts some of that attention. You can focus elsewhere and really give in to that surrender a little bit more. Is one aspect.
Absolutely. You nailed it. Yeah. And anatomic asking, is very well known for that. But I believe since midwifery has been around for thousands of years, that it's
midwives.
The idea has been there, but it's like not been as like in the education component. But yeah, I mean, we say like open mouth, relaxed jaw is an open cervix and relaxed pelvic floor. So like, those
and envision that.
Those low moaning sounds with your jaw, like if you're moaning and sighing and that mooing sound, your jaw is open and relaxed and vibrating, releasing tension. And that correlates to the pelvic floor and the cervix, just like what you're saying. And so that's kind of how we simplify it, is like open jaw, relaxed jaw is open cervix, relaxed pelvic floor. And we need both of those to occur. So,
and then ohms and the sounds that activates vagus nerve. So then that totally tunes you into that that calming aspect of things. So that goes in line with what we were talking about. So now segueing into what to do about jaw and pelvic floor tension. And so you and I both mentioned it as far as, and I'll do this with my kids before bed. We'll go through do a little body scan, and I'll have them clench their hands and relax, and clench and relax, and we'll move along all the major muscle groups that you can. Can you bring all the tension to that area, and then can you let it all go? Because that does train the body to say okay, this is what it feels like to let that tension go. I mean, I think that's what you have to know. You have to know a little bit about what that tension feels like before you can be like, well, yeah, let it go. I don't know if
because
I think tense? I don't know. My tense, your
people
shoulders
don't
are
know
by
they're
your
tense.
Yeah.
Or the obvious things might be tense, but there's other parts of your body that might be tense that you don't know until you've done that exercise. So this week, I mean, maybe you call it this, but the body scan. And so we teach about this in our childbirth education class, for partners to learn how to do with their wives or spouses or, the pregnant person during pregnancy, is to start the body scan early and often. And that's getting into before you go to bed or first thing in the morning. But a lot of times before you go to bed is better, and doing what you're saying, but having the partner sort of walk them through like you do for your boys, be that guide for them, because having someone else do it can just be a little bit more relaxing. And practicing that, it's going to help you have a better night's sleep. And then once you're in labor, and you're especially early labor, when we really are trying to prevent that stress from building up, the partner, it's a good time. We're partner, hop back in. And when you guys are beginning to take a nap or rest, do the body scan and use your hands. If physical touch is comforting to her, put your hands on her head and bring attention there, and put your hands on her jaw and on your shoulders and on her hips all the way down. And so we love that tool. And I think it's highly, highly beneficial to help release as much tension. And it's a wash and repeat.
And make you feel safe. You feel that helps with that safety feeling, that comfort feeling.
Well, as you're lowering your stress levels, you're not fearing your surroundings as much. Right? So you feel just overall safer.
That is another way to help with that tension. And even in some yoga classes, they will, and some that I've done and some of the instructors I've used will do things where you'll do some breath work in it, because that's the next thing we're going to talk about. But you feel the tension in the body, you hold the tension, and then you either pulse or you relax it. And you can sometimes yoga will do body scans as well too. So yoga can be something that, something that you can take a class throughout, pregnancy, modifying the moves. Oh, we had the episode with Julie Hawkins, all about prenatal and postpartum yoga. I am blanking on what episode number that is. I'm going to have to write that down because I want to go back and put that in the show notes here. but that's another way to calm the body down and
Mm-hmm.
kind of involve like vagus nerve as well. So to bring the tension in the cranium and the sacrum to help that go away.
And I think the
Mhm.
yoga practice mixed in, if you are especially like a CrossFitter or a weightlifter, or really like doing, even if you're doing like bar or dance,
Mm-hmm.
like all of those are wonderful, and running, like all of these are wonderful, but bringing yoga into your practice, into your routine. So if it means maybe doing one less of the other workout, like implementing yoga, especially during pregnancy, and then I really think postpartum too, I think that's essential
Mm-hmm.
for ensuring that pelvic floor is softening and
Right.
lengthening.
I'm glad you said softening, because those other sports that we mentioned, they are a little bit more intense, right? So they may
Mm-hmm.
not focus so much on relaxing. That's a little bit more of heavy lifting or engaging those muscles. It's a lot more engagement. And so that's perfect to have something that
Mm-hmm.
softens, that elongates, that
Mm-hmm.
counterbalances that tension there. So yeah, it's great to do those things. We definitely want you to do
Yes.
those things, but it is nice to have that counterbalance. I'm glad you mentioned.
Yes. Highly recommended.
Breath work. We talked about this. I did do an episode, episode 61, Finding Your Breath, and that was a bunch of different little exercises you can do, like breathing exercises. And then we went a little bit more into like vagus nerve and the different parts of the nervous system as well there too. So, but this is important, and something that it would be good to work on those breathing exercises throughout pregnancy, so that when you get to labor and birth, that you have practiced them and you know what works for you. Because I think in that episode too, I mentioned that there's one breathing exercise, and I tell people about it. I can't stand it. I feel like it causes me anxiety, probably because I haven't done it enough. But I don't like it. So if I don't like that, then that would not be the one that I choose. But if I'm not practicing while I'm pregnant and I go into like, I'm getting ready to have a baby and I'm like, oh, I'm trying to do this box breathing and this is just causing me to hyperventilate more. And, so practicing it, practice during pregnancy.
Yeah, you have to practice. I mean, you can't say it enough. We say this also with our clients and in childbirth education, because we feel like, and I say I work in partnership with my doula partner, Hannah. So we're like one, but
You made it sound like, no, it's like we the doulas feel like that's
the
what
doulas. I mean, I don't want to speak for all
I
doulas,
know.
but in my practice, we say that your breath is your greatest tool in pregnancy and birth and postpartum, because you need it when you lack in sleep and breastfeeding your baby and all of that. But especially during labor, like there are lots of tools, and people try to have like all these like things prepared for birth. They want to know the positions, and they want to know the tools, the peanut ball, the birth ball, the squat bar, the squat stool, the like all these things they can use during labor, which are all helpful. I'm not saying they're not, but your breath is always with you wherever you are, whatever you're facing, and can serve you. So the breath, we feel like, is the best number one tool you should be focusing on, versus trying to gather all these external things. It's internal. And that breath work is the best. And we highly encourage it. We say the same thing about practice. And we feel like, and I think you agree, like the breath work is helping also reset your parasympathetic nervous system. And there are definitely certain types of breath work that are going to help reset you if you're going through moments of stress. So like we talk about resetting the parasympathetic nervous system, like if you're having a hospital birth and you're going through, after you go through triage, like you've been laboring at home, you've been doing your thing in your own zone, things are going well, but as you're transitioning to the hospital and going through triage, like stress is going to come up, tension's going to come up. Maybe you're clenching your jaw, maybe you're holding things in differently. So when you get into your labor and delivery room, that's a great time to do some of these breathwork exercises that you share about, and kind of thinking about resetting your parasympathetic nervous system to bring the cortisol levels down back to where you were.
I'm so glad you mentioned that, because like you always have that breath with you. I don't want to necessarily say that it's something that you can control, but that's where some of that piece can come from. Where they're like, okay, I can control my response to this, and I can use my breath to help with that as well too. I feel like I've said this before. In The Wizard of Oz, Glinda the Good Witch, didn't she say something to Dorothy about like you've had the power all along, like it's in you, like you've
It's
had
in
that,
you.
Yeah. So it's the same thing. And then gosh, that could be paralleled to so many people that come in and they're in pain and all these things. And I'm like, you have so much power within you, like you have all the healing
We look
capabilities.
outside of us for answers first, for whatever reason. That's our society and culture versus trusting if we go inward. But sometimes that's scary and complicated and hard and difficult to access. But usually what we need is inside of us. But that takes going slow, being intentional, knowing it'll be uncomfortable. Because you mentioned this a moment ago too, that I wanted to add on to, as far as like the breath work. Like our normal regular breathing is fine. That doesn't usually cause us much stress. But when you're doing this like focus type of breath work, it might feel uncomfortable at first, or actually it most likely will feel uncomfortable at first. And maybe it makes you feel a little bit more anxious at first, or a little bit more tense. Like when we do the box breathing and we talk about that, I always give my own self, like I have to fight myself when I'm doing the box breathing, trying to relax before going to bed. Like 4 in, 6 out. 4 in, 6 out, or whatever I'm doing. It makes me irritated. Like the first breath. I'm like, this isn't working. This isn't for me. I don't have time for this. Whatever. Like I get flooded with all these, like, you don't need to be doing this. And I'm like, and I do this regularly, right? But by breath, like 5, because I decide I'm committed to the practice, I start feeling
not a one and done.
Better. And then by 10, I'm like,
you don't even realize it.
You don't even realize it. And like Hannah gives her example, and she says it takes her to getting to 10 really before it starts feeling better. But then the benefit down the road is so worth it. So knowing that when you do it, it might initially create some discomfort, and that's part of the process.
It is part of the process.
Yeah.
Now you mentioned, and we talked a little bit about how, that it can be scary going internal and having and looking and trying to navigate that internal aspect of things. So, and I kind of wrote my note of like, oh, you have the power within you. But that's how, and I just did an interview with another chiropractor, Dr. Twyla. I don't know when it's going to come out. It'll be out before this episode. But she talks so much too, and I loved it when we talk about that with chiropractic care. It's not so much the chiropractor doing the work, it's just we facilitate healing. Like it allows the body to heal itself and to function optimally. So that's my segue into chiropractic care as it relates to jaw and pelvic floor tension. There are multiple layers, and there's going to be multiple layers too with pelvic floor PT with this, because it's not just like a cervical adjustment and that impacts just one area. Like it's that whole body function. It's that whole body looking at things. So if I'm thinking pregnancy related and really focusing on that, it's obviously Webster technique. We've talked about it multiple times in the show. There's lots of episodes on it. I don't even know which ones, but it's that pelvis and sacral analysis and adjustment to help restore the neuromechanical function. And so it's not just the alignment of the pelvis, but also the nerve supply going to the pelvis and the uterus as well. So all of that. And when we can balance that, it balances the ligaments of how the uterus is in the body, and it can allow for optimal fetal positioning there. And when we have that alignment, pelvis is hopefully able to open better, and you're able to relax better, more evenly for labor and birth. But there's bone, muscle, ligament we work on the patient posterior side and anterior side, but it's full body as well. So I mean, everybody, if you're Webster trained, yes, you're focusing on the specifics there. But then if you're going to another chiropractor that practices full spine, then I'm also looking at the thoracic spine, and I'm also looking at the cervical spine, because everything is connected, right? Remember that. That's where I want to go back to is remember it's all connected as well too, because I will do some hypoglossal release. So like tongue muscle release. So right underneath the jaw, and you can actually do it to yourself as well. So you'll just take a finger to press on and you're pressing like inferior to superior underneath your jaw, like right at what we call that mental protuberance. And so you can press there. And it's, again, I liken it to a little bit of like, okay, do you feel that tension? Okay, release it, let it go. And you'll be like,
Mm-hmm.
whoa, it's amazing to feel the tongue holds a lot of tension. The tongue holds a
Mm-hmm.
lot of tension because it's like actively engaged. When it's resting, we want it up on the roof of the mouth. And so when we can press in there and you can feel it, okay, is there a trigger point? What's going on here? Then you can kind of release that as well. So
Mm-hmm.
again, I'm just kind of going over the specifics of some of the stuff that I do in the office, but then there is the cranial work as well. So there is definitely craniosacral therapists out there. There are chiropractors that are trained in it. There are doctors of osteopathy that are trained in it. Those tend to be the two, I guess. So sometimes I know some nurses that have received extra training. They usually have some sort of biological medical background.
Mm-hmm.
And then, or even massage therapists as well, again, to that anatomical background. But so there's different trainings within craniosacral therapy, but chiropractors can receive that training as well. And so, and having done that work, I do cranial work on babies. We've talked about that with Dr. Martin Rosen, but you can also do cranial work on adults as well, too. And it is very, very impactful. There's a little bit, there's certain cranial touch points that are used, and there really is a feeling for that rhythm. So remember, I talked about that the craniosacral pump, that primary respiratory mechanism, that intrinsic rhythm of the cranial bones connected to the sacrum and how the sacrum moves. And so when you walk, this is why movement is so important. You are moving the hips and the pelvis, the sacrum is moving, and it does this like nutation and counter nutation motion. So it's really, it's not like a flexion extension. It's not internal and external rotation. It's this weird like figure 8 kind of motion and movement that it does with the bones of the pelvis. And then in the skull, like I said, you've got that sphenoid bone, and it does its own special movement as well. Again, not talking big motions and movements, but a lot of times you're feeling for that pulsation, the rhythm. That's really what it boils down, that rhythm. There's a specific rhythm that's supposed to be with it. And so cranial therapy can be really, really helpful during pregnancy, not only for, especially too, if someone's got like severe pelvic pain, I may not be doing more physical adjustments. It might be using an instrument. And so that's a little bit more of a lighter technique, more what we call a tonal technique, but then cranial work can do wonders for that. Even if we're not touching the sacrum as well. So, and to reiterate the fact that like a lot of times where you're feeling the pain is not necessarily where the problem is. It's just where you're feeling it right then. It doesn't mean we won't address that. And it doesn't mean, like, no, like this, the elbow hurts because the elbow got hit, like, or something along those lines, like this difference than that. But everything is connected in the body there. And so that's when that cranial work can play a big role. And every office is different. And I talk a little bit, I don't know if I talked about this, but I did like a hot take on chiropractic care, how it's only for pain and fetal malposition. So it's episode 122. I touched briefly on this, on like the external factors of care and how it can impact the nervous system and how you're processing stressors in your world and adapting. And I do still have plans to have someone else come on and really go through the intricacies of the vagus nerve a little bit, more in depth and better than what I've done. So that will be coming as well too. But that's what I look at with care. Posture impacts vagus nerve. Cervical adjustments can impact vagus nerve, which can bring calming effect. Cranial work also can impact vagus nerve. Then it's going to impact, trigeminal nerve, all of your cranial nerves. Posture, we talked about that. I don't know. It can impact a lot.
Yeah.
That's what I'm looking at with care.
It's incredibly beneficial. We highly recommend it to all of our patients and clients, and definitely seeing that Webster trained certified practitioner. And then cranial, if you're doing the cranial therapy, that I know that's like an added thing. But just even if you're not pregnant, but if you're pregnant, expecting, I hope you hear that, your body is going through a major event and experiencing so many things, and having chiropractic care along the way can just help support the entire system. That's not just about fixing low back pain. So thank you for elaborating on that and always enlightening us with the benefits of chiropractic care. I did want to add something that you mentioned earlier about fascia. So as a doula, birth doula, fascia, that connective tissue that you touched on earlier that holds tension, like you said, holds tension. I was like, I cannot believe I didn't add this to our outline, but doing practices to release the fascia during pregnancy can help tremendously with reducing overall tension, like tension that you don't even know you have. And so things that can help release fascia, especially during pregnancy, is doing like some belly sifting with a scarf or a rebozo, doing, it's called shake the apple trees. It's like when you get in a modified hands and knees and you have someone or a partner or your doula sort of shake your bum, and it's creating, so that jiggle after an amount of time releases the fascia, and it's not aggressive. It's like,
no, anything with the fascia it is light. It's not
very
not like a
light.
deep tissue massage. It's not deep motion movements. Yes, I'm glad you're mentioning
so make
that.
sure learn how to properly do it, but it can be simple. Like I did a spinning babies training back in October and really learn, because I've always thought like belly sifting was like the main thing to do, but that's just one part of the body and not accessible for everyone. So they taught us like doing this 3-part jiggle, like when someone's lying on their side, and just taking your hands gently like on the hip that's up if they're lying down, and just jiggling that hip, and then moving to like the buttocks and shape, gently shaking the butt, and then to the sacrum and doing the vibration. It's almost like you're giving like a wave type of shake, but not aggressive, and doing like a minute each, and then do the other side. That's another way to, communicate to the fascia, especially during labor, early labor, or even pregnancy. I mean, do it during pregnancy for sure. And then it can be something you can do during labor. We can help release the fascia, which holds tension that we didn't even know we had, and can just help, again, we're talking about like opening the pathways for labor to unfold smoothly and effectively. But I thought that was something I wanted to add that was
yes,
part
no,
of
that's
this
right in
conversation.
line. Yeah, because there are those things that you can do, and again, too, it doesn't have to be so like aggressive. You don't think of it as like, like it's a very simple thing.
It's a very gentle.
And I guess too, this episode, like, it's not just for pregnant patients or pregnant people, whatever. It's like, this is where, I mean, everybody's got these things. Like, you have all of this connection, whether you're pregnant or not. You have the embryological, you have the internal, external anatomy of it. You've got the nerve connections. You've got cerebral spinal fluid. Like, you have tension. Like, this is. So
no, I think it's helpful
for everybody. So for your spouse as well, too.
I'm 10 years postpartum and dealing with the pelvic floor and jaw tension, and something that, and these are kind of our last 2 points that we've touched on that can help with these, with your jaw tension and pelvic floor tension and just overall tension. But that pelvic floor therapy, pelvic floor PT is great for anyone, wherever you are in your journey, pre-pregnancy, pregnancy, postpartum. Highly, highly recommend it. That type of, it's everything from like your hips up to your shoulders,
it's
really.
Diaphragm, it's breathing, breath work, pelvic floor PT and breath work. And that PTs that can do that, and the dysfunctions in the breathing patterns, that's huge. Because I don't think I've had a lot of people not realize that their diaphragm and their breathing are directly connected to the pelvic floor. And so, I see really good results when my moms are able to do both, when they're able to get adjusted and see a pelvic floor physical therapist as well.
And it's not just like incontinence, or it's not just like problems, just like everything else, but there might be some underlying things you don't even know is happening. Like a lot of my back pain and hip, lower back pain were directly related to my pelvic floor. And so, but we started with like simple learning, like how to breathe, and move my diaphragm,
to retrain those movement patterns. Yes.
Like, we do a simple test, and I'm like, sure, I know how to do this. And she's like, but you don't. So your very first assignment is to literally just practice breathing intentionally. And started there. And then it was a great, so I mean, I was recommending it before my own personal experience, but it's
Yeah.
it's so much more just like chiropractic care. You don't have to have something wrong. Like we encourage those, like go get aligned with a pelvic floor
Yes.
therapist, go at least once during pregnancy. And then, you're set up with them for postpartum. So they can get you started on gentle movement, gentle exercises, healing your pelvic floor properly so that you can return to full functioning and full whole health after you've given birth, so that you're not trapped in this, oh, well, I just gave birth, so I have I have these pains, or I have these incontinence or whatever. Like they can really help mitigate all that. And another thing that I learned about for jaw tension, and I'm sure you share this with your clients too, but facial cupping. So like I was struggling with TMJ, with really inflamed TMJ, and went to the dentist first, and their only solution was like a $4,000 Invisalign thing, which I might need because my bite is off. But I was like, but I'm in like a level 9 pain.
Yeah.
And so this Invisalign isn't like what I needed in that moment. So I might revisit that, but they didn't offer
anything else. I know.
Nothing else. And I wasn't looking for medicine, but like jaw exercises. I mean, this facial cupping that I learned about from my chiropractor, I go up to Dr. Alex Howell, and, she was working with me, and she was like, have you tried facial cupping? And I was like, facial what? And there's like these little suction cups. I bought them off Amazon. And after I wash my face at night, it just
and
is
you
like,
can move. It's like a little bit. Yes. You can keep them there and do it. I've had it adjust or massages. I was going to mention massage too, where you move it along like with the muscle as well. Gua sha stones can be really good, and I'll have people dig in, like you can open when I'm doing jaw adjustments sometimes too. Oh yeah, talk about I mean, it doesn't take much pressure at all, but I'll teach people too about like, okay, this is the direction I want you to move, this is the pressure that I want you to move. You can open and close the jaw with it. When I'm doing adjustments, sometimes it's like I need jaw open a bit, I need it
you
closed,
can feel it. Yeah, but she assessed that on me. She was like, look, this is where you're off, and then she used her little gun and tried to help get it in the line. And she was like, it probably won't stay in line as long as you are having the tension. So we got to get that tension out of there. So we were doing like inner, like with my thumb, like inner massage, like along the top of my cheek.
I have a massage therapist in the area, and I'm thinking of patients in particular where I've referred them for internal and just head and neck and just mouth and to like release that. And then going and speaking afterwards, they were like, this was the most magical thing ever.
Like I had no idea. Yeah. Like where she showed me
massage therapy too, and not just the cupping.
Massage and the cupping. And again, all of these should be like, you should be working in conjunction with your practitioner of choice. But just things to share about that. Again, like we're not just saying go relax. Like it takes like doing some certain things to help release the tension, things you didn't even know were available. And things that have helped us personally. So,
and remember, this little bit of facial cupping, this little bit to release that tension there it's like the ripple effect in your body as well too. Not only is birth a ripple effect in how you are going to go into motherhood and your birth story and all of that. We've talked about that ripple effect, but you also have the ripple effect of the things that you do to care for your body that impacts it as a whole. So it's these little things. Don't think of it as minor things, and give yourself credit for like, okay, I'm going to work on this, and it may not seem like much, but that can make a huge difference in the pain and tension in your body and the stress in your body as well too. So just remember, and just it's all connected.
And take it one step at a time. Like we've shared a lot of information here. You might feel overwhelmed. Don't let that stop you. Like just take one thing that resonates, or take one question to ask to your chiropractor or pelvic PT or whoever you're working with. Like just take one thing away and know that that will lead to the next thing. I feel like everything I know now, and it's not near what I know I will know in the future, but like it's because of like one step led me to a person, a resource, information that then led to another thing. So when you can just see it as like, I'm going to do the one next thing, and that's it. That's all you got to worry about right now. So just pick one thing here and start there, because I know it can feel overwhelming when someone's in pain or experiencing something and there's a lot of go do this and it's a lot. That can also be paralyzing. So I don't want to create that. We always just want to offer information and options and things to think about and better, deeper understanding of your body, and just take one thing and go forth.
Exactly. One thing and go forth. I love it. And hopefully you have a better understanding of how your jaw and your pelvis are connected. Yeah. So that's the takeaway. Everything's connected to the body, and just do one thing. Keep moving forward. So glad to have you on the episode today, Rachael. This was fun. Stay tuned every Wednesday for our next episode. Thank you for joining us on the Aligned Birth Podcast. We hope you found our discussions informative, inspiring, and enjoyable. Remember, when your body, mind, and intuition are aligned, you have the power to overcome any challenge that comes your way. We appreciate your support and leaving a review or rating, signing up for our newsletter, or becoming a direct listener supporter. Your contribution helps us continue delivering valuable content and reaching more listeners like yourself. Stay connected with us through our newsletter to receive the latest episodes and bonuses straight to your inbox each week. You can also connect with us on Instagram at aligned_birth. All links can be found in the show notes. Together, we can make a difference in the lives of the birthing individuals and new moms. Thank you for being a part of our community. We look forward to sharing more empowering conversations on the Aligned Birth Podcast. Until next time.